You're listening to The Bird Bath. Welcome back to The Bird Bath. Each week we scrape the surface of the news you need to know, so let's get into it. This week I feel like a real academic. Maybe I'm ready to go back to school, but it's summer, and so maybe I'm just wishing that my girls were back in school. Because, man, summer is hard. But nonetheless, we've got some great stories for you this week, all with, most of them at least, with a little bit of a thread of education at the core. So, kicking us off this week, Hill's Pet Nutrition has launched a groundbreaking microbiome research portal alongside Harvard's Chan School. The One Health Microbiome Resource, or as they call it, the OHMR, or I'm hoping they call it OMR, is a groundbreaking online platform that gives researchers free access to over 2,000 pet microbiome samples, tools, and protocols. And I'm going to call it OMR the whole time. And if they're not calling it OMR, OHMR, I mean, they're just missing out. But the OMR aims to accelerate pet and human health discoveries by enabling collaborations across science and industry. They're working to study how diet and environment influence the pet microbiome, and researchers hope that this will also help them improve digestion, disease prevention, overall wellness, and then also utilize some of these things in a One Health approach, connecting the overall quality of health and life for pets, people, and the entire planet. Now, this is something the data has already been utilized and acting, and they've been building on this with lots and lots of years of research. Using this data, Hills has already funded several groundbreaking studies. One of their recently published studies was in the International Society of Microbial Ecology journal, which, I mean, what a page turner. And they detailed the collection of companion animal gut metagenomes, which helped people better understand the tiniest little aspects of what's going on within our pets. The overall significance here is that they're able to now take these things and better understand what we're feeding our animals and how that's affecting the microbiomes within their digestive tracts. Another study is being done that's really analyzing dietary fiber sources for canines, and they're also seeing how that overlays on human health absorption as well as dietary utilization of fiber. So lots of really cool things going on here. And you know what? I felt like every time we can say something good about Harvard right now, we might as well. So big ups to Harvard as well as Hills for bringing the One Health Microbiome Resource. It's going to be a continued and great thing, and I recommend everyone that has a use for these types of tools to check it out. There's a link in the bio so that you can look more into it. Another university that's making some waves is Oklahoma State University, just north of me here. They have received $250 million in state funding to build out a new state-of-the-art veterinary teaching hospital. They said the money is the largest state appropriation in the university's history, and it goes alongside the $78 million that was allocated to them in 2023. It's going to be a seriously cool new hospital, and I hope to get an invite to come and check it out. The new hospital is going to have all types of technologies for both small and large animal care. They're going to have an advanced imaging tools, CT, MRI, radiography, and ultrasound, a linear accelerator for oncology treatments, and an aqua cow float tank, which is what I feel like when I get in the hot tub. OSU has stated that the 255,000 square foot facility will replace the existing 145,000 square foot facility, which was built to serve 60 students, which they've now ballooned this team and the number of students to over 150. So they're desperately in need for this additional square footage. And it's going to be really cool to see how they put this money to use building a world-class facility. Another facility that's getting some help, this one not from state funding, but from Chewy. Chewy Health has pledged $1 million to support educational space inside Clay County, Florida's new animal services building, which they're opening hopefully in 2026. The Chewy Health and Lincoln Memorial University Applied Learning Center is designed to give hands-on training for LMU veterinary students during their first 6 semesters on the Orange Park campus. The university is yet to open there, but the College of Veterinary Medicine in Orange Park is seeking the accreditation from the Council on Education, which has its hands full. But really cool to see Chewy hopping in here and helping grow the footprint that LMU is bringing to the veterinary landscape. Now, one final, I'm going to call it academic, because you know what? It's a research paper. There's new research suggesting that patient safety investment positively impacts health outcomes. It reduces the costs related to patient harm, improves system efficiency, and helps reassure communities and restores their trust in the healthcare system. With the new study, which was done with Mars Veterinary Health along with Johns Hopkins University, just one of my favorite, or their Johns Hopkins Armstrong Institute for Patient Safety. I mean, we are really stretching these names out this week, but it's a 2-year research project that took the voluntarily reported patient safety events, PSEs, for more than 2,000 primary care, specialty, and ER facilities in the US, UK, and Europe. Now, this was very interesting. It's definitely one that a lot of people would expect, right? If you are monitoring and tracking these patient safety outcomes, you're going to find that there were issues and opportunities and places that you could do it. It was very interesting that they dove a bit more in the study that was published in JAVMA. They looked at all the different incident types, patient outcomes, species, and also what type of practice they were in to understand the long-term outcomes of the patient care. Dr. Melinda Larson, who's the director of medical quality at Blue Pearl, said, due to the extensive range of data sets, we have identified common findings that can guide us in pinpointing areas of focus most likely to enhance quality improvement and patient outcome. The thing that I found really interesting, not only the fact that, what we saw in human healthcare and some of the changes that they made to improve patient outcomes definitely can be applied into the veterinary space, and shows that a lot of the medication errors were the largest categories, both in human healthcare as well as in veterinary medicine. But as a bit of a sleuth, I really enjoyed looking through the full text because this was done at Mars clinics across the United States and Europe. And it was interesting to see the counts of practices, the number of animals that were seen. And it is data from 2021 and 2022, but it was very interesting just to dig through and see kind of the number of facilities, the type, the things that were happening within these facilities, and get a little bit of a glimpse under the hood. Now, it's anonymized, but if I tell you that there's a Mars primary care group with 1,065 practices in the US, a lot of you can probably guess which one that is. So interesting to see that. Always excited to dig into some of these reports. Again, I'm going to link a lot of this stuff in the show notes so that you guys can dig into these more if you want to. Now, our final peer-reviewed piece that we're hitting on this week is a new study that calls for the resurgence of independent veterinary practices across the U.S. So the analysis, which is called Making the Case for a Resurgent U.S. Independent Veterinary Practice Segment, a SWOT analysis, was published by Martin Trabwarner, Matt Solis, Charlotte McKay, and Marnie Platt, who a lot of you are probably very familiar with these 4 authors. The new study makes the case that independently owned veterinary practices in the U.S. are poised for a resurgence. They say that despite increased consolidation, these clinics still hold powerful advantages and could be on the upswing. They utilized a SWOT analysis, which is strengths, weaknesses, opportunities, and threats, to kind of track down what the different opportunities here or different places that people might be able to look at this. They highlighted some of the strengths of independent clinics offering Again, this was their paper, but they say they offer a higher job satisfaction, better mentorship, and lower burnout for veterinarians, and that they also tend to have higher, stronger relationship with local communities and reinvest profits locally. There were a ton of sources cited. If you're looking for a bunch of data to be able to try and understand how the industry is going, you can definitely look at not only their paper, but their sources through Frontiers in Veterinary Science publication. The weaknesses were just a lot of the things that we see in consolidation, right? They don't have the backing of corporate infrastructure. They have higher costs. Sometimes they are slower to adopt technology, and they can have difficulties with efficiency and client experience by not being able to have the capital that might be needed there. They see a lot of opportunities here for increase of vet schools to train the new students coming out in business so that they are more aware of and prepared for business ownership. And they think that there's an opportunity here for new independent practices to continue to thrive and flourish in the US. Great thing to dig into. Obviously, the authors have some really interesting background, VMG, vet books, a lot of great things, and a lot of things that are targeted towards the independent practice owner, but well-researched, well-cited and sourced paper that was peer-reviewed and recently published. Finally, I love a good summary, and this one was one that I really liked because it brought data and compared and contrast data from 2022 to 2025. Synchrony has published their 2025 Pet Lifetime of Care study, and they hit on a lot of these hurdles that we've been talking about for the past year, 2 years, 3 years, 2 years. Let's say 2 years, right? They did a great job, though. They got over 1,200 owners and 100 veterinarians to respond to their survey, and they were able then to compare the results of this same Pet Lifetime of Care study that they did in 2022. The big things that stuck out were the rising lifetime pet care costs. They said over a 15-year lifespan, dog care costs now ranges from anywhere from $22,000 to over $60,000, which is an increase of almost 12% since the study in 2022. And cats are getting even more expensive as well, ranging from $20,000 to over $47,000, which is nearly a 20% increase since the data in 2022. There's a underestimation of the expenses in the pet parents. And so they said 80% of pet owners underestimate the lifetime cost of pet care. And before, I've already said the numbers, but ask them how much they think it's going to cost them to own their dog or their cat for the life of that animal. And the data that they got here was that dog owners estimated it to cost around $8,000 for the life of the animal. And cat owners said that it costs less than $6,000, which is each less than 3 times the amount of the estimates on the low end, and in many cases nearly 7 or 8 times what it could cost them to own that animal for its entire life. Another thing that I found kind of interesting, not just, because I don't want to just belabor the rising costs, but I thought the thing that was important here was the preparedness and readiness for unexpected expenses. In the data, they showed 26% of dog, cat, and mixed animal owners were stressed out or concerned by a bill of less than $250. And for small animal owners, that number was 51%. Both of those are just staggering because a $250 bill is not to be unexpected in a lot of situations when you're bringing your pet in. So the stress that people are feeling about even under $250 bills is definitely something to think about. Cat owners, being the responsible pet parents that they are, were reported to be significantly more financially prepared for unexpected expenses than their canine counterparts. But surprisingly, 10% of pet owners in the study had to borrow money to cover their veterinary expenses. So it's a really interesting report. Again, the links are going to be going crazy this week, so check it out. There's a ton of things. And I'll also make sure that I put all of these links in my Substack. I think these are something that a lot of people are going to want to dig more into. And if you want more on these and other stories, you can join us by subscribing to our Substack. There's a link in the bio. And don't miss out on any episodes by subscribing and rating the show. For the Bird Bath, I'm Ryan Leach. See you next week.